The day that you start, don't expect in 6 months that you'll have significant population level change. Will you see some change right away? Yes. But will the whole population move in a way that can change prevalence? It won't happen overnight. So that's something that you have to talk to the decision makers, those who are funding the campaigns, that they have to be patient. And that's a hard lesson. When you talked about political support and gaining political support, they have to be prepared that this is not a problem that's solved overnight. We just celebrated the 50th anniversary of the Surgeon General report in the United States. And yes, the smoking rate's been cut in half. We do have success, but it was a 50-year fight and it's still not over. So patience is something that they say is a virtue. But the encouraging thing is that there is really strong evidence around the world that supports that mass media campaigns can reduce the smoking prevalence, initiation, and progression to greater use. So how do they do it? Well, common themes are some of the things you might think about, highlighting the health consequences of using tobacco. But also, there have been cases in the United States and elsewhere of shining a bright light on the tobacco industry's manipulative advertising and way of seducing people into smoking. And so countering their very effective advertisement with counter-advertisements is a strategy that's been used in the United States and elsewhere. Another thing is to think about exposure to secondhand smoke. Parents who smoke, they have children oftentimes, and they're worried about the exposure of their children. That's a message that you can use, highlighting the dangers not only to themselves and their friends, but their children. And then also just trying to change the social norms, reminding people that not everyone smokes, and in fact, most people don't smoke in many countries. So one of the things that sometimes is a hard lesson to learn in terms of the strategies for campaigns is that the very friendly, positive, upbeat messages, well, frankly, they don't always work. And in fact, they probably don't work very well compared to some of the other stronger messages that highlight fear or disgust. And because those are the ads that those that are most at risk say that they like the most. So it's okay to use humor on occasion, but if you really want to get inside people's heads and change their behavior and change their way of looking at tobacco, you may have to use stronger messages that some view shocking. And I'll give some examples. But the good thing about those messages is that people get complacent. They smoke every day, they know the risks, but it's easy for them to ignore. So the campaigns that have been effective really are getting in your face. They're really reminding you that if you keep using tobacco, there are serious health consequences. So the other complicated thing about implementing an effective mass media campaign